Back with Dr. T, let's talk about liposuction. I heard there have been a fair amount of improvements, in order to, suck out that fat. Tell us a little bit about what it is used for, what are the improvements, and the effects of it.
I think the biggest improvement has been the development of what we call tumescent liposuction under local anesthesia. I think people always imagine when they think about liposuction, they think about an aggressive tube that goes in the body and sucks out the fat. And this has been done for many, many years. Over a decade ago, a Dr. Klein, who's actually a dermatologist, discovered that we actually can give local anesthetic in a given area, let that sit for a few minutes, and it kind of prepares the whole tissue. So what happens, it becomes virtually painless. The client is totally awake. We can use smaller tube to suck the fat out so there's less irregularities. The patient will turn from side to side as we need them to, so they're never totally paralyzed like with general anesthesia, so the risk of blood clots is much less. The bleeding is much less. People are losing teaspoons of blood instead of cups of blood. The one thing it does take more of when we do it under local anesthesia, it takes more time. But fortunately, we don't charge by the hour, we charge by the area. So a patient who chooses to have liposuction under local anesthesia is providing, I believe, not only a better result, but a far safer result than being asleep.
Okay. Now, I've heard that there is, the newer liposuction, there is some of them kind of like heat up the fat, and by doing so they get it out better. Some deal with, water or whatever it may be, and then so there's all kinds of different things. Is there a difference? Should the patient or the client know about those things, or is all that not so important?
I would say, there are no question there are different technologies, and I think one of the biggest, most recent advances over the last few years is definitely in terms of the laser lipo. Now, of course, people know about smart lipo. It was the first laser lipo FDA-approved device. We were actually the first to introduce smart lipo to Monmouth County, New Jersey. But more important, whether you're using a smart lipo device, whether you're using slim lipo, body jet, is really the experience and the meticulousness and the eye of the surgeon. I remember when I was initially training many years ago, I would have other doctors that would come and get trained, and I would be part of their training them and helping them. And some people just don't have the dexterity. They don't have the eye for the detail and to have the coordination. It takes a certain person with the appropriate skill, eye-hand coordination, and the meticulousness to be able to do a good job.
Okay. Now, let's talk about, what is liposuction for? Apparently, it's not here to actually, be a weight loss program. It's more like a contour thing. You get a better shape. So tell us, shed a little light on that, and tell us in which areas of the body it can really be making a big difference when it is used.
Very good point. When we promote liposuction, definitely it is not weight loss, it is body contouring. So a person who is particularly heavy, could they benefit from liposuction? Certainly they could, but it's not going to show as much of an effect as someone who is not as heavy. If we look at the term, we use the term BMI, body mass index, and there are many places on site if a person doesn't know their BMI, they can go online and they can actually discover what it is. But generally, we like to operate people somewhere in the 25 to 30 range BMI. If they're much beyond 30, 31, 32, it becomes a little less effective. It's basically considered definitely a body contouring rather than weight loss. The areas we can do, pretty well any area. The most common area, I would say, is certainly the abdomen, also the waist, hips, inner outer thighs, buttocks, lower back. It's even available for men, for example, who have excess breast tissue. We can do it for gynecomastia. Women can do some breast reduction using liposuction. So and the other area very common is the neck. People have the chicken neck, the neck hanging down. Sometimes it's fat that's excessive there. In other cases, it may not be fat. It could be simply overhanging skin. And this is another part of the laser lipo. The thing that the laser does, not only does it help to melt fat, but by heating the deeper dermis, heating the deeper skin, we can actually stimulate new collagen. So we actually can have a skin tightening effect with liposuction, with the laser lipo, that we couldn't have in any other way.
Wow. So the generation of collagen seems to be an important thing here, and many of the procedures you're doing, including liposuction, seem to be, like you talked about it in the fillers, that if you do them a few times, for some reason, collagen gets created again. And whether we at this moment know what that really is or means, but it does mean that your skin gets tighter and better looking, and that's a good thing. So basically, yes, you're stimulating, it looks like you're stimulating the body to do something, almost like giving blood. You're stimulating the blood to replenish itself, and by doing so, you right there become more healthy, more strong, and it's one of the best chelation therapies you can have for all purpose. So that seems to be all going hand in hand with that.
Indeed.
Wonderful. And again, are there any long-term side effects? We're not talking about like being a little bruised, being a little sore for a few days or so. We're not talking about that stuff. We're talking about if that even happens. We're talking about, is there something, down the road, which just simply might not be a good thing,
Nothing that we're really aware of. I think a very common question patients will ask is, what if I gain weight? Will I undo the benefits of liposuction? Now, when we're doing liposuction, we're removing fat. Whether we actually suck it out, whether we melt it with a laser, we permanently remove fat cells. Now, if a person has a lifestyle change and they gain 20, 30, 40, 50 pounds after their procedure, they will gain the weight in all areas, but it will be less so in the areas that we actually removed the fat, because proportionally there's less fat there. Can they undo some of the effects? Absolutely, but it'll be less apparent in those areas that we actually treated, because there are fewer fat cells there.
Right. So obviously, if you start blowing up like a balloon, even if you don't gain it at the, love handles anymore, you'll start looking ugly, or not so good if you gain. But what you're telling me is, so let's just say, I'm now at 175 pounds and, probably 15 pounds overweight and there's a little bit there. So if whatever I take off, I keep my lifestyle, I don't really gain, I stay at that level more or less, you're telling me that, even though I got those love handles because of my lifestyle, too much eating most likely, do little exercise, that they really won't grow back. Is that what you're saying?
Yes, if a person maintains a reasonable lifestyle, that fat never comes back. It is a permanent change. Now, some people, if they're particularly heavy, may get a liposuction treatment, and they lose more weight, and they may want a touch-up, or they may want other areas done. That's very common.
Right.
I remember I had one patient that she had 8 areas treated, in between inner outer thighs, upper or lower abdomen, lower back, upper back, arms. And when we're doing several areas, multiple areas, we may not be able to do all those areas in one sitting, because there's a maximum amount of local anesthetic we can give to be in a safe zone.
Sure.
So the good news is you still only have one recovery, because we will do, say, 2 or 3 areas initially, wait 2 or 3 days for the anesthetic to clear out of the system, after which time we will then treat the other areas. So you basically have one recovery, but you're able to cover multiple areas for that patient.
Wonderful. Okay. Yeah, well, that makes sense that there's only so much you can do. It's like going to a dentist. There's only so much work you can do in one day. as such. Well, again, wonderful. Well, that's basically good news. So I like the fact that it is stable, that it actually doesn't go, because that's the biggest problem. We lose weight, we do something, and it's one thing to do that, and it's another thing to keep it that way, because most of us, if we have that love handle, if you have that double chin, which came because of too much fat, it's unlikely to say, I get an operation now, or whatever you call those things, a liposuction, whatever it is, a procedure, and then I'll change my lifestyle. Because if you could change your lifestyle, you would have done it already. And obviously you wouldn't need it, or at least you would need a lot less. So the fact is that we probably keep our lifestyle, and if then it doesn't come back, I think that's really good news. Thanks a lot, Dr. D. Thanks a lot.
Very welcome. Pleasure. Always a pleasure.